little bit now about physiotherapy management. So it is really important if spasticity is sort of impacting you, it's a good idea to have a functional assessment done by a physio, because we want to determine whether or not your spasticity is affecting your functional ability and in everyday life. Because in fact, for some people, so for example, a person with very weak legs, they actually might find that their spasticity makes their legs more rigid and helps them to stand and transfer or walk. And without that spasticity, they might be too weak to actually do any of those things. So if in some cases, if the spasticity is actually helping with those things, treatment may not be necessarily needed. However, someone else might have spasticity in their calf muscle, which is causing them to trip on their toes, especially if they get tired and they've been walking around for a while, and it's restricting their ability to move around. So in that case, definitely, we'd want to treat the spasticity and try to have an effect on that. It's important to examine which muscles are affected by spasticity and to what severity. And it's also important to find out if the spasticity is causing any pain or disrupted sleep, and if it's worse at particular times during the day or night. So some people will say that it's worse, say, for example, first thing in the morning. Some people will say it's worse like overnight while they're sleeping, and other people might say it's worse at the end of the day when they're quite fatigued. So they're important things to know in terms of treatment options as well. So with physio, a lot of, I guess, our main goals is we want to prevent contractures. So we want to stop the muscles becoming tight and the joints becoming tight and stiff. We want to help reduce pain. We want to improve function, so your ability to walk or stand or transfer and things like that. Also, if you do have any spasticity in the upper limb, we want to make sure that you're able to use your hands for everyday tasks such as eating, cleaning your teeth, reaching up over your head. So, they're all the things that spasticity can affect. So stretching can help. So for example, if you find that you're quite stiff first thing in the morning or when you first stand up after sitting down for a while, often it can be a good idea to do some stretching before getting out of bed or before standing up to kind of temporarily reduce that stiffness. And also stretching can help to prevent contracture in the muscle and the muscle getting tight. Strengthening, so what we say is often it's good to strengthen the opposing muscles. So for example, if you have spasticity in the hamstring muscles causing the knee to want to bend all the time, strengthening the quads muscles, which is the opposing muscle that wants to straighten our leg, that's a good idea because that kind of combats that spasticity in the hamstrings. So again, that's why it's important to have a assessment by a physio to find out which muscles are affected by spasticity, which muscles are weak, and so which ones we want to strengthen. Cardiorespiratory exercise, so exercise that makes you huff and puff, is a good idea because it improves fitness, can reduce pain, reduce stress and fatigue as well, which again are all those things that can kind of feed into making your spasticity worse. And some people find benefit from using physical modalities such as TENS machines, hot or cold back, depending on how it affects you, and massage and things like that to help manage all those symptoms. So I mentioned, as a physio, I want to kind of prevent muscles getting tight and prevent contracture. So one of the ways we can do that is we can use splinting and positioning. So these are just a few examples of different splinting techniques. So on the left-hand side, you can see a person wearing a leg wrap that keeps the knee nice and straight. So this could be beneficial for somebody who has spasticity in their hamstrings causing their knees to bend. I might ask them to wear a splint like this for a few hours each day to really give that hamstring a good stretch to prevent it getting tight. The image that on the top right of the hand splint, sometimes I do have clients that have spasticity causing their hand to kind of curl up and fist a little bit. So this kind of splint is good to just keep those hands and thumb open. And again, this can be worn overnight or for a few hours a day to try to prevent that contracture. In the bottom picture where you see an orthotist fitting a splint to someone's foot. So it can be quite common for people to have spasticity in their calf muscle, causing them to trip on their toes or not be able to get their heel down when they're walking. So often wearing a splint such as a AFO, ankle foot orthosis, to help keep that ankle in a nice 90-degree angle while walking can be a really good idea too. So they're kind of looking at different ways of splinting to help prevent contracture. And then also, you can do different sort of positioning techniques or stretching to help maintain that muscle length. So in that picture on the bottom right-hand side, there's a man doing some long sittings to stretch his hamstrings. So, this can be done, for example, you can be sitting in a chair with a nice straight back and put your legs up on another chair in front of you. So the idea is to have the hips and pelvis at 90 degrees and the knees out nice and straight. And this gives you a good stretch of your hamstring muscle.
Jackie?
Yes.
Just before you go on there, just
Sure.
one query. We've just got Lynn asking whether, and excuse my pronunciation here, whether fasciculation is the same as spasticity?
Sorry, say that word. I'm not sure if I've said. Can you spell that word for me?
Yeah, Fasciculation. Fasciculation.
I'd have to probably get back to you guys on that because I'm not quite sure what you're talking about there. So I'm happy to, I'm happy, like if that person wants to email that question through, and I can see if I can find an answer to that or.
Fabulous.
Yeah.
Lynn, I can email that to Jackie, and then she can, research that for you and get back to you. Jackie, it was in relation to a knee problem. There was some muscle, twitching on the inside, and there was also, some stuckness in a finger. So yeah.
All right. No, I can definitely have a look, sort of, at that question a bit in more depth afterwards.
Fabulous. Thanks, Jackie.
Great. No worries. All right, so just again talking about some stretching. So one of the stretching techniques that's quite, it can be quite useful for both kind of improving your flexibility and also kind of dampening down the spasticity a little bit, is proprioceptive neuro-facilitation, PNF for short, stretching. So you might have heard people talk about PNF stretching. It's used in sort of, you'll see sports people using that type of stretching, but also, in the neurological population. So the aim is to improve muscle length and flexibility. PNF is sort of a contract, relax type stretch. So you're holding a contraction of the muscle for 5 to 10 seconds where you're pushing gently against the stretch, and then you relax and allow the muscle to stretch a bit longer. I'll show you guys some pictures of that next. And there's some evidence to suggest that long-term stretching can kind of help change the sensitivity of the stretch reflex a little bit. And when I say long-term, it is quite arduous because you kind of got to do it every day and kind of keep doing it. It's not something that can, you just do sporadically. So this is kind of examples of PNF stretching. So this one on the left here, you'll quite commonly see out on the sporting field, and this person's trying to stretch the hamstring. So the person on the ground and the trainer is kind of pushing their leg back towards their face, and the person has to contract against the resistance. So they have to try to push their leg back down against the trainer, and they'll hold that contraction for say 5 to 10 seconds, and then they'll relax and then stretch a little bit more. And the idea is to keep doing that sort of say 5 times in a row to get that increased stretch in the hamstring. This one on the top right is actually one of our patients here in our gym here at Lidcombe. So she's actually stretching her quads muscle, and she's using a strap to provide the resistance herself, which is quite a handy technique that you can do at home. The idea is she's pulling her foot back towards her bottom, so that's kind of stretching the quadriceps muscle at the front. And then what she does is she pushes her leg down against the strap, so against that resistance, pushing down and holding that contraction for 5 to 10 seconds, and then relaxing more into the stretch and pulling that foot back to get more of a stretch. And again, she does that, say, 5 times to stretch the quads more and more. And this is a nice simple calf stretch. So as you can see, this girl has the band wrapped around the ball of her foot, pulling her toes back to get that nice calf stretch. Then if she pushes down against the band for 5 to 10 seconds in that nice contraction, and then relaxes more into the stretch. So they're different ways of stretching the hamstrings, the quads, and the calves. And you can do that with all muscle groups depending on where you have spasticity and what muscle groups need stretching. So I did talk about strengthening the opposing muscles, and any muscles really that have weakness in them is a good idea. So just some guidelines for strength training. So generally strength training should be done, say, 2 to 3 times a week, and making sure you have a rest day in between strengthening sessions because your muscles need to recover in between sessions. You should work up to doing about 2 to 3 sets of 10 to 15 reps of an exercise, and you should be using a heavy enough weight that you struggle to do the last few reps. So as you can see in the picture, the girl's doing bicep curls. So the idea is, for example, she might be doing 3 lots of 10 reps. So she does 10 repetitions, has a rest, another 10, has a rest, and another 10. And at the last set of 10, she should really be struggling to complete all 10, and that means that the muscles are going to change and get stronger. Sometimes you might not need weights at all. If you've got a very weak muscle, you might be able to start with just no weights until you get stronger. You should increase the weights or the resistance as you become stronger. So once the exercise gets easier, you want to then increase the weight. You don't have to use free weights. You can use body weight or TheraBand. So for example, body weight, squats is a really good way of strengthening your quadricep muscle. And a physio or exercise physiologist can advise you about which muscle groups need strengthening, and they can advise you about correct technique and different ways of doing it depending on what setting you're in. So whether it's at a gym or at home or, in an outdoor park. So it's a really good idea to get some specific advice for yourself. Aerobic exercise. So I mentioned that aerobic exercise can be really good for reducing fatigue and pain and stress and all those kind of things that can play into spasticity. So the guidelines for aerobic exercise is sort of say 2 to 5 sessions a week. It can be done in consecutive days, so you don't necessarily need rest days, but with MS, because you may suffer from fatigue and it may take you a little bit longer to recover from exercise, you might need a rest day in between, but it is safe to do, every day if you wanted to. And it's a good idea to kind of work up to a 30-minute session. If you can't manage 30 minutes, starting just at 10 minutes is fine, and gradually work up until your endurance improves and you can do 30 minutes. So when we talk about aerobic exercise, we talk about activities that make you huff and puff. So, your breathing gets harder, your heart rate increases, and you're kind of sweating and things. So walking or hiking, swimming, cycling, playing sport, or any activity that you enjoy that really, makes you huff and puff is a good aerobic exercise.
Thanks very much, everyone. Bye for now.